Cancer symptoms in women. Breast changes. Doctors suggest that if you have a lump in your breast, do not ignore it and consult your doctor right away. Some of the other breast changes you should look for is the dimpling of the breast skin. In other words, if the skin of your breast resembles with the skin of an orange, then it could be a sign of inflammatory breast cancer. It is a very aggressive type of cancer and often indicated by red swollen breasts. Rectal bleeding. The third most common type of cancer is the colon cancer. Although many people associate rectal bleeding with hemorrhoids, but this is not always the case. Any traces of blood in the stool can be a sign of rectal cancer, and it is important to consult a doctor under such a situation. Vaginal discharge. Vaginal discharge could indicate endometrial or cervical cancer. Women should be cautious if they have a smelly discharge with traces of blood in it. Also avoid taking over-the-counter drugs for the treatment of the discharge. Bloating. Ovarian cancer is the deadliest of all the cancers of the reproductive system. There are 4 major symptoms that indicate ovarian cancer. They are bloating, feeling full, frequent urination, and pelvic pain or low back pain. Consult your doctor in case of more than 2 symptoms. Your doctor might suggest a pelvic exam followed by a sonogram and a blood test. Irregular bleeding. Women who have hit their menopause should be cautious about any sort of bleeding, spotting and blood clots. These symptoms might serve as an indication for cervical or endometrial cancer. Spotting other than the menstrual cycle and heavy bleeding during the periods can be a negative sign for women who have their periods. Your doctor might suggest a sonogram or a biopsy. Skin changes. A change in the size, shape, or color of a mole or other spot is a common sign of skin cancer. See your doctor for a thorough exam and perhaps a biopsy. This is one time you don't want to wait, Mayer says. Blood in your pee or stool. Talk to your doctor if you are bleeding from a part of your body that normally doesn't, especially if the bleeding lasts more than a day or 2, Mayer says. Bloody stool is often from hemorrhoids, but it can also be a symptom of colon cancer. Bloody urine is usually the first sign of cancer of the bladder or kidneys. Trouble swallowing. Occasional trouble swallowing is nothing to worry about. But when it happens often, especially with vomiting or weight loss, your doctor may want to check you for throat or stomach cancer. He'll look into your symptoms with a throat exam and a barium X-ray. During a barium test, you drink a special liquid that makes your throat stand out on the X-ray. Weight loss without trying. Most women wish extra pounds would magically melt away. But losing 10 pounds or more without a change in your diet or exercise habits could signal a problem. Most unintended weight loss is not cancer. Stomach and lung cancers are also possible. Heartburn. Too much food, alcohol, or stress, or all 3, can cause serious heartburn. It is suggested that you change your diet for a week or 2 to see if your symptoms get better. If that doesn't help, talk to your doctor. Heartburn that doesn't go away or gets worse could mean cancer of the stomach, throat, or ovaries. Cough. Most coughs go away on their own in 3 to 4 weeks. Don't ignore one that lasts longer than that, especially if you smoke or are short of breath. If you cough up blood, go to the doctor. A cough is the most common symptom of lung cancer. Mouth changes. If you smoke, watch for white or bright red patches inside your mouth or on your lips. Both can signal oral cancer. Ask your doctor or dentist about tests and